So to stretch the levator scapulae, you want to put your one hand on the scapula to stabilize it and look over to like an angle, your head, like eyes facing down, and put your other hand over your head and like gently pull your head down and give it a nice stretch.
Okay. The origin of the levator scapulae is the transverse process of the vertebrae C1 through C4. The insertion point is the superior angle to the medial border of the scapula. The action, in which Hannah is demonstrating right now, is involving in flexing the head and neck laterally. And the nerve supply or innervation is the dorsal scapular nerve, C5, the C3 nerve, and the C4 nerve.
A very common upper body injury is something called impingement syndrome, or swimmer's shoulder. This is caused by the connective tissue in the shoulder rubbing against the scapula. Pain can be consistent, or it could get worse over time if not treated. Symptoms are arm weakness and pain, and if the tendons go untreated for a long time, then it can actually result in a tearing in the rotator cuff muscles. Treatments are stuff like rest, or you could take anti-inflammatory medicines like ibuprofen. This is an upright row. The primary muscle in the upright row is the deltoid, the acromial part. The deltoid is originated on the spine of the scapula, the clavicle, and the acromion process. It's inserted on the deltoid tuberosity on the humerus. This is moving through the frontal plane. The brachialis and the brachioradialis are also involved in this lift. The brachialis is originated on the anterior humerus and then is inserted on the coronoid process of the ulnar tuberosity. The brachioradialis originates on the upper two-thirds of the lateral supracondylar ridge of the humerus, and it's inserted on the base of the styloid process. This is innervated by the radial nerve C5 through 6. This is a dumbbell incline bench fly. The primary muscle in this is the deltoid, which originates on the spine of the scapula, the lateral clavicle, the acromion process. It's inserted on the deltoid tuberosity, moving through the sagittal plane. You have glenohumeral transverse extension here. Also, the subscapularis is in this lift. It's originating on the subscapular fascia, and it's inserted on the lesser tuberosity of the humerus. The teres major and the teres minor are also involved in this lift. The teres major is originating on the dorsal surface of the inferior angle of the scapula, and it's inserted on the crest of the lesser tubercle of the humerus. The teres minor originates on the upper two-thirds of the lateral margin of the scapula, and it's inserted in the greater tubercle of the humerus.
Alright guys, I'm going to talk about an injury for the biceps brachii muscle. So this injury can occur by experiencing high forces from activity, whether that is weightlifting or it could be lifting like a heavy household object, really that could be anything. But this can cause a grade 1 muscle strain, a grade 2 muscle strain, or a grade 3 muscle strain. Early treatment includes rest and ice to the front of the elbow. And to avoid this injury, you're going to want to maintain proper strength in the shoulder, elbow, and forearm. So like all of those areas around the biceps brachii. You're also going to want to avoid repetitive overhead lifting and overuse of the shoulder.
Another upper body injury is something called a bicep tear strain. A bicep tear is a strain or a tear in the bicep muscle that can occur in the shoulder or the elbow. The tear can be complete, and that's like as the tendon is torn completely away from the bone, or it can be partial. Bicep tears or strains are classified in grades from 1 to 3, depending on severity of the injury. So grade 1 would be like a minor injury involving overstretching of the bicep muscle or tendon. Grade 2 would be more moderate tearing around the muscle or the tendon, with some loss of mobility and strength, and then a grade 3 would be a complete tear. Risk factors for things like this would be people with poor circulation, people with previous shoulder or upper arm injuries. The most common symptoms would be like weakness in the shoulder, bruising on the arm, inability to move or rotate your arm, and muscle spasms. This is going to take your arm out for about 2 to 6 weeks and be in a cast or a sling, and it won't fully, if it's a full tear, it won't like fully recover for about 4 months.
Okay, so to stretch the bicep brachii, you want to do a extension of the elbow joint, which is the opposite of how to strengthen it, which is flexion of elbow joint. But a good way to do it is to just place your hands firmly on a wall and rotate your trunk a little bit and really concentrate on your bicep and give it a stretch.
This exercise is working the biceps brachii muscle. The origin of this muscle is the supraglenoid tubercle of the scapula. The insertion point is the radial tuberosity. The action includes flexion of the elbow joint, supination, abduction, and internal rotation of the humerus. And the nerve innervation is going to come from the musculocutaneous nerve. And the arterial supply, just for an extra fun fact, is going to be the brachial artery. In order to stretch the coracobrachialis, you're going to get in a sitting position, and you're going to extend leaning in like this. Do the other side. Get a nice stretching.
The origin of the coracobrachialis is the coracoid process of the scapula. The insertion point is the upper third of the frontal humerus. The action is flexion, adduction, and internal rotation. And the innervation is the musculocutaneous nerve.
In order to stretch your subscapularis muscle, you're first going to start by putting your palm in supination formation, and you're going to extend it over your head, and then you're going to flex that subscapularis muscle. So I'll show you. You're going to be flexing right here. Get a nice good stretch in that muscle.
Okay. The subscapularis' origin is the subscapular fossa of the scapula. The insertion is the lesser tubercle of the humerus. The action is internal rotation and extension of the arm, and the innervation is the subscapular nerve.
So I'm going to talk to you guys about an injury for the pectoralis major muscle. This injury can include a muscle rupture or torn pec, as they say. A partial tear can occur, however, they are not as common. Usually it's going to be a complete rupture of the tendinous attachment of the muscle to the bone that it occurs. If a complete tear occurs, surgery is the most recommended method for a treatment. It's going to be the most effective. A torn tendon may be repaired also by placing a large suture on the torn tendon. And how to avoid, this is important, you're going to utilize proper technique, especially with weightlifters, and this will help prevent injury to the pectoralis major muscle. In order to stretch the pectoralis major muscle, I'm going to press against this wall, and I'm going to extend and really get a nice stretch in the pectoralis major. Nice extension.
The origin of the pectoralis major is the medial half of the clavicle, the manubrium, the body of the sternum, the costal cartilages of the ribs 1 through 6, and the anterior layer of the rectus sheath. The insertion point is crest of the greater tubercle of the humerus. The action is adduction, internal rotation, and flexion of the arm, assists in respiration when the shoulder is fixed as well. And the nerve supply is medial and lateral pectoral nerves. To stretch your teres major, what you want to do is put your arm over your head and take your other hand and grab your elbow and gently pull it medially for a flexion of your arm. Okay.
The origin of the teres major is including the dorsal surface of the inferior angle of the scapula. The insertion point is the crest of the lesser tubercle of the humerus. The action includes internal rotation, adduction, and extension of the arm, and it is innervated by the nerve, subscapular nerve.
This is the inclined shoulder raise. The primary muscle in this lift is the serratus anterior. The serratus anterior originates on the upper 8-9 ribs and it inserts in the medial border of the scapula. This is a movement in the sagittal plane. A secondary muscle in this lift is the pec major, the clavicular part.